Hey, let's talk about the Psoas, one of our dominant hip flexors. Here it is here on the model. Inserts with the lumbar, comes down to the femur, right? However, what if someone comes in saying they've got hip flexor tightness on their left side, all right? And they're in what we call a torsion with their body. Say the common one is the left to right torsion. So going to the right this way. It's the left ilium going forward, posterior, right side posterior, like so. It tips the sacrum. What it does, it gets a torsion going on in the body, meaning this lumbar spine starts to turn to the right because the ilium is going forward, it's pushing on the sacrum. So the lumbar, which sits on top of the sacrum, is turning to the right. So therefore, this psoas muscle on this side of the body going down to the femur is going to be automatically short. So yes, they need to stretch and manually do some therapy in there to release that, to allow that to go back. However, if they got tightness and the sense of wanting to stretch the right side, that would be wrong, because these transverse processes on this side, the insertions of the psoas are already going posteriorly, right? So if we stretch this side, that would be incorrect, because it would what? Further go in more of a torsion with the lumbar spine. So we have to know what's happening in the lumbar spine, its relationship with the sacrum and the iliums, to understand what we need to do with the psoas muscle. If someone is in a side bend pattern, let's say a right side bend pattern, and that's typically my position. So the right side bend of the lumbar spine, and the correction comes out this way in the thoracic spine. What do you think is happening? This right psoas is tight. This one is locked long. So it's this side that needs stretching. It's this side that needs stretching, but this side needs strengthening to bring it back. So the whole sensation of the left side needing a lot of stretching is incorrect. We need to strengthen this side, bring this side into closer balance, and also what also happens with a side bend is this right ilium tends to flare out, which creates havoc with the iliacus. The sensation is to stretch it when actually it needs to be brought in along with the lumbar. That makes sense? How about someone coming in with a flexion pattern, which means flexion of the hips, extension of the spine. Depends on what kind of medical professional you're talking about. That can be, the wording's got to be careful. So you have to understand that. Explain to them what you mean by your postural pattern. So we're going to call this one flexion of the hips, extension of the spine. Okay? So that means the psoas muscle is going to be evenly on either side, to where, yes, we want to stretch this side. But what if someone comes in with a more pogo stick back, which means extension with the hips, flexion of the spine, lack of extension? This psoas muscle, hip flexor here, is going to want to be strengthened more so than released with manual therapy. So it's important that as a manual therapists and body workers, we need to understand what's happening here. And this is what we talk about in our classes, restoration of complications with the low back and low body. I look forward to seeing you soon. Take care.